Hi everybody, it's Adam with HeartValveSurgery.com, and we're answering your questions that were submitted at our website and Facebook. Thrilled to be here with Dr. Patrick McCarthy, who's the Executive Director of the Bloom Cardiovascular Institute at Northwestern Medicine. Dr. McCarthy, thanks for being here.
Thanks, Adam.
Great, and we're going to be answering a question from Betty DeRoche-Crump, who writes, what are the percentages of people who die after aortic valve replacement?
Good question, and obviously important if you're going to undergo surgery. You can't answer that very simply. You can't just say it's 2% or 5% or something. It depends on the patient. So if we operate on a very healthy 50-year-old with a bicuspid aortic valve, the risk of death may be as low as 0.5%, like 1 out of every 200. If you're talking about an 85-year-old who has bad lungs and maybe kidney failure and things, you could be looking at 10, 15 or more percent. And those are the patients that we treat more with TAVR these days. So we as surgeons and the nurses have ways that we calculate what we think the risk will be, but also sometimes you have to just use the judgment of the surgeon. Some people just look very frail, like they're going to have a hard time recovering from surgery. So it's an important question, and if anyone that is going through it, they should insist that their surgeon give them sort of their best estimate of what they think the risk to their life is to go through surgery.
Great points as always, Dr. McCarthy. And for Betty, I think what you're relaying here is the patients need to ask the questions.
Absolutely.
They need to get educated, is that right?
My patients show up and they have a little list of questions, and then by the end of our talk, they've checked them all off, and if we didn't get through all of them, if we only got through 18 out of the 20, then they ask the other 2. So
Right.
they should just bring that along.
Great
they should
advice.
ask about that stuff.
Well, Dr. McCarthy, thanks for everything you're doing.
All right.
Thanks for
Adam.
taking care of the patients. We always say here, keep on ticking.